We've now got, importantly, around 10 minutes for discussion with our leaders here, our leaders in the front row, with all of us to actually test, challenge, comment about what you've heard so far, about what you've read in the document, about the aspirations for people across the South East Coast. I shall chair this and I'll pass to the appropriate person, which could include one of the Pathway Group chairs in the front row.
Thank you, Christopher Allen. I'm a consultant in dental public health. I think it's been absolutely excellent and fantastic. And all the talk about the clinical excellence in patient, we mustn't take our eye off the fact that we would like people not to become patients. And the first bit, the healthier people, is very important. And I think primary prevention is extremely as important as everything else we've been talking about today. And I think we mustn't take our eye off that ball either.
I think I mentioned that mental health was a cross-cutting theme, but the other thing that was clearly cross-cutting was staying healthy. And the groups found that this was absolutely vital, keep people away from surgeries in the first place. I think we struggled slightly, and I'll let Tom say something, but I think we struggled slightly because although there are things that we can be proactive about once they're happening, we felt we also needed some help centrally to do some of these things, particularly with obesity and alcohol abuse. So staying healthy was really top-notch for everybody, but probably not only locally but nationally as well. Do you want to say something?
Thank you very much. Yeah, the thing about the Staying Healthy group, it did resonate quite a lot with members of the public, and we did find that a lot of what we were saying, the public were already telling us already they were very engaged in this agenda, so it was a very positive group to be in. And as Ed said, a lot of the things we were saying are things that, I won't say we weren't innovative, but the things that we've been crying out for a long time. And we saw this as a means of really putting a lot more pressure to get better food labelling, better controls around alcohol, better buy-in nationally in terms of addressing obesity. So it was a very positive experience for us. It resonated with the public. And even when we took it across, I'm not sure whether the other groups did this or not, but we worked also as chairs nationally. And we found a lot of the things that we were saying across the country were very common. There's a big opportunity, I think, in terms of the workforce in pulling in. The NHS is a huge employer. It's not always the best in terms of practice with our employees, and we identified that as a huge opportunity, similarly with local authorities, actually to practice what we preach.
Thank you, Tom. Question in the middle, right in the middle of the middle.
Hello, Rochelle Howard, expert patient programme tutor and also acting health trainer. So I just wanted to come in on those 2 points really, and to assure the audience that hopefully with the emergence of health trainers, I'm hoping that we can go to reducing some of those inequalities in keeping people healthy and identifying people when they have problems before perhaps they go into the primary system or indeed are perhaps hidden currently. So I think that's sort of been taken care of, and I hope that your group will continue with that and ensure that we've got the investment to continue our volunteer work. Of course, some of us are now being employed.
Thank you very much for that comment, and I'm quite sure... Ed, yes, of course.
One further thing that cropped up with that is it's quite easy if you're wealthy to be able to look after yourself. But what came out of staying healthy was clearly the areas of deprivation. And again, that was a cross-cutting theme across a lot of our groups. It's how you actually provide that for those people and keep them interested and on board with that. So that again is a major challenge for us to deliver.
There's one thing I'd like to say though, and I think this would be fair to lots of people, that once people gone out into the community and learned to be independent, in some circumstances there are lots of people, through no fault of their own, find it very, very lonely and very, very difficult to get going at the very, very beginning. But once they start learning to be independent, it slowly comes to go, and it makes them much more better to improve.
Thank you, Leslie. Thank you for that important insight.